In necrosis, there are several types. There is coagulative necrosis, liquefactive necrosis, febrile necrosis, and the gangrene. A necrosis is defined as a sum of morphologic changes that follow the cell death in living tissue and organ. This one is caused by enzymatic digestion of organs, and cytosol by enzymes, and denaturation of the proteins. So this is why you see the cell death. This one is the cell injury, and remember that necrosis is reversible. Here there are basic changes of cell necrosis. Here you see the normal cell. Here is the chromatin margination. Here there is pycnosis. Here there is condensation of the chromatin. Karyolysis, where there is cramping of the chromatin. And there is karyolysis, total destruction of the chromatin. So I have said pycnosis, the nuclear shrinkage, and decreased the basophilia. And the DNA apparently condenses into a solid version. Karyolysis nucleus undergoes fragmentation. You see this one. And the karyolysis, the basophilia of the chromatin may fade and the nucleus disappears. As you see here, it is like there is no nucleus. And this one is fragmented. Here it is on tissue. This one is the pycnosis, karyolysis, and the karyolysis. Here it is kind of necrosis. This one, it was not fluid material. This one is necrosis. So the type of the necrosis. Let us start by the coagulative necrosis. In this type, there is preservation of the basic structure, opening the coagulated cells or tissue for a span of days. Here there is denaturation of both structural and enzymatic proteins by injury, or subsequently increasing intercellular acidosis. For example, on this image, those it was enough pink or red, these are necrosis. In the case of coagulative necrosis, there is an increased eosinophilia. Eosinophilia means this pink or red color. And decreased basophilia due to loss of RNA in the cytoplasm. And increased binding of eosin to denatured cytoplasmic proteins. So in the case of it is more homogeneous appearance and the loss of glycogen particles. So for example, this one, it is in renal tubules. This one it was eosinophilic. This one in the case of necrosis. This one is in the kidney, and here there is a necrosis. You see this shape. It is the features of infarction. We will see them in the hemodynamic disorders. What is infarction? Where there is infarction means that there is no oxygen in the tissue. So this one is total necrosis. And this one is the beginning of the infarction. You see how there is a change of the blood vessels. Here it is in kidney, so in spleen, there is a coagulative necrosis here. It is irreversible. Once you see this organ, it is better you remove that organ because there is a cell death. This one is in the adrenal gland. This is the shape of the infarction. This is the capsule of the gland. Here there is some inflammatory cells. You must know the subtype of coagulative necrosis is caseous necrosis. This one is white cheese. It is a characteristic of tuberculosis. It is in the lung. You see this necrosis. Here it is in the kidney. This white yellow cheese appearance, it is necrosis. When you see this image in your tissue, the first diagnosis must be tuberculosis. Here it is on the histology. Here, this one pink is caseous necrosis. And those small dots, those are lymphocytes. And this one is the giant cell, known as Langerhans giant cell type. When you see this image on microscope, it is a characteristic of TB. You see this giant cell, this is eosinophilic material, this is coagulative necrosis, known as caseous. There's a small dot lymphocyte. Another type of liquefactive of necrosis is liquefactive necrosis. This one is caused by the bacterial or fungal infection or amoebiasis. For example, this one, it is in the liver abscess caused by amoebiasis. This one is liquefactive necrosis. When there is that abscess, you have to drain that abscess because it is a dead tissue. A stroke in the brain, it is also a type of liquefactive necrosis. You will see it in your neurology course. Stroke can be hemorrhagic or ischemic. This one is hemorrhagic, where there is destruction of some blood vessels in the brain. This is an image of the stroke. This you see the swelling of the neuron. Another one type is fat necrosis. You see here the word fat. This one can be traumatic, for example, in the breast, and activated by pancreatic lipase in the pancreatic tissue. Here you see some, maybe it is not clear, those are fat. Here there are some inflammatory cells. We'll see it in your practice. Fat necrosis, most of the time is found in the breast tissue after a trauma on the breast, because the breast, we remember in histology, there is fat. For this one, there will be inflammation and the injury to the fat. There will be fat with inflammatory cells. This one is known as fat necrosis, even in the case of the pancreatitis. This is what we call fibrinoid degeneration. This one, it is deeply eosinophilic. It is found in collagen disease, necrotic vasculitis, and malignant hypertension. You see this one, homogeneous, deep eosinophilic material. This one, red. This one, it is fibrinoid necrosis on the blood vessel. Another one is the gangrene. It can be either dry or wet. Dry gangrene is a subtype of coagulative necrosis, whereas wet gangrene is some type of refractive necrosis. There is another one called case gangrene, but the most common it is this one of wet and dry. You will see it in your clinical practice. For example, this one, it is gangrene on diabetic patient. I have one question. Is this one dry or wet gangrene? Question. This one is dry or wet gangrene?
Dry.
This one, very good. This one is the dry. Start by here on the toes. There is oxygen deprivation. Then the change of the color. The skin will become like black because of loss of oxygen. And you continue like this one and this one. This is where they have done the amputation on this part. Before doing the amputation, you must know where there is a problem on the blood vessel. If the problem is the upper on the inguinal part, you can't do amputation. So for this one, they have done amputation. Maybe the problem was only here. And you amputate until you reach the living tissue. Because if you amputate on this one, the necrosis will continue up. So it is better where you amputate where you see the living tissue. Living, I think it is where there is bleeding. Once you see the bleeding, it means that there is living tissue. So this is an image of that dry gangrene. Here there is a gangrene of intestine. And what you must know, what is that not written here? Most of those wet gangrene, they are caused by some bacteria, Clostridium perfringens, if you have done your bacteriology. It is the main cause of those refractive necrosis. And the gangrene, it has a bad smell. A bad smell. Here the starting of the gangrene of the intestine. For this one, you have to remove because there is a death of cell. The effect of necrosis, they can be absorption, discharge, erosion, disorganization, encapsulation, and some calcification. So this one is eosinophilic material, this is necrosis. So I have shared with some link where you can see some images of those necrosis. Your leader will share with you some links where you can see some images of those for your practice. Apoptosis. Apoptosis is a programmed cell death. Apoptosis can be pathological or physiological. Physiological, it is what you have seen in your embryology, case of embryogenesis. This one is the physiological. Hormone dependent in involution tissue. This one is physiological. But there are some cell deletion proliferating. For example, in some tumor in the lymphoid organ, when there is a cancer in the other, this one is the pathological apoptosis. For example, pathologic atrophy in parenchymal organs after duct obstruction, cell death by cytotoxic T cell injury in certain viral disease, hepatitis, this one it is pathological, cell death produced by a variety of injury stimuli, for example, in mid-term injury. Let us see some morphological features of apoptosis. Is cell shrinkage, chromatin condensation, pycnosis, and then fragmentation, karyorrhexis, formation of cytoplasmic blebs and apoptotic bodies, because apoptosis will concern on the nucleus, even on the cytoplasm. And then there will be phagocytosis of apoptotic bodies by adjacent cells or macrophage. In apoptosis, there is no inflammation and the membrane is intact compared to necrosis. In necrosis, there is destruction of the cell membrane, whereas in apoptosis, the membrane is still intact. For example, you see some images where you see membrane damage. This one it is in necrosis, and this one it is in apoptosis, where there is some phagocytic bodies. See here, there is nuclear chromatin condensation and fragmentation, but there is no destruction of the cell membrane. On this image, you see here some pycnosis, and here some pycnosis, and here you see apoptotic bodies. It is a comparison of necrosis and apoptosis, we have said.
Question.
Yes.
You say that apoptosis is cell death. What do you mean by being cell death? Saying apoptosis is a programmed cell death. Then
We have seen it in your embryology. When there is a embryogenesis, you see there's some involution and cell death. This one, it doesn't mean it is the cell will have a plan to be died. So it means that it is a progressive. It is like, for example, in the case of cancer, there will be, for example, viral infection, for example, Epstein-Barr. Then they continue progressively destroying the cell. And those apoptotic bodies, they are phagocytosed by adjacent cells. This is why you say it is programmed. Compared to that necrosis, immediately there will be cell membrane.